The World Health Organization estimates that each year approximately 1 million people take their own life. That's one death every 40 seconds. Experts predicted numbers would peak in 2020, but no one could have imagined the devastation brought on by COVID-19. During the coronavirus pandemic, you may experience anxiety, sadness, and loneliness. Existing mental health conditions, including severe anxiety and major depression, may worsen. If you're feeling hopeless, contemplating self-harm, or you're concerned about someone else, I'm here to tell you there is hope. A Mission for Michael is dedicated to helping clients achieve complete inner and outer transformation. Mission for Michael is the premier resource for intensive mental health treatment in Southern California. With an astonishing 2-to-1 client-to-staff ratio, each client in their facility receives individual care 24 hours a day, overseen by a team of all doctorate or master's level clinicians. With a focus on evidence-based treatment, along with personalized and compassionate care, they offer mental health treatment that can change lives. If you're suffering from mental illness or you're concerned about a loved one, go to amfmtreatment.com. Again, that's a mission for Michael, amfmtreatment.com, or call 866-581-4401. Again, that is 866-581-4401.
This episode of Dose of Dr. Drew is also sponsored by Hydrolyte.
Hey, everybody, let's pile on in. I already see that you guys are excited about our guest today. Ashley is saying, oh, she helps. She's my favorite. She helps me to stay calm. So that's a high compliment in this crazy world.
Are you talking about Kelly or me?
Well, you too, to be fair. And so interesting. There's some interesting things happening right now out there in the news. I don't know if you're aware that the governor of Florida held a roundtable that Andrew Ashkasvili very kindly exposed me to yesterday. And on the heels of that, he decided to open up Florida, which I thought is a very bold thing to do. And I'm going to bet that Kelly Victory, our Dr. Kelly Victory, will agree with that. She's, of course, our regular on the show here. And you guys like her more than you like me, so we'll bring her back.
Okay, here she is.
Here's Dr. Victory. Hey, Kelly, how are you?
Hey, good, Drew. Thanks for having me back.
So what do you think about Florida? Did you hear about the Florida thing?
I did. I listened to the entire press conference. And as you predicted, I think that Governor Ron DeSantis is spot on. I give him a lot of credit for it. And I think that history will look back kindly on his decision. Primarily what he did was say he's acknowledged what we've known all along, Drew, which is that we are not all at the same risk from COVID-19. We are not, the vast majority of us, in fact, are not at any significant risk at all. And the good news is we know who the risk people are. So he has acknowledged that we've got to stop penalizing the vast majority, that the 90% of the population that really is at little or no risk from this, and stop the economic devastation, social devastation, psychological ripple effect of this entire lockdown. Let everybody get back to work who can, while we take precautions for that relatively small percentage of the population that actually is at significant risk from some sort of bad impact from this particular virus.
In fact, when it works, which I suspect you're right, I suspect it'll look a little scary at times. There'll be some spreading that they'll have to kind of pay attention to. But I think it will work in the sense that it will be collectively a net positive. I think as a result of that, people will really question the constitutionality of people that overreached impulsively, don't you think?
Oh, there's no question. And I think what you will see is, I believe that if you look at Sweden, for example, or Japan, countries that already did this, that already proved, look, we pretty much went around, business as usual. We took reasonable precautions. We let, most of them were voluntary precautions. And lo and behold, when it's all said and done, they had pretty much, Sweden in particular, had pretty much the same death per capita as we did in the United States, but without the smoking crater of an economy that we have in this country.
And the mental health consequences, which will rival.
Exactly.
There's a couple interesting things. I need to get a piece of paper because you trigger lots of ideas in my mind here. Hold on. Oh, I can barely get to it without tearing my earplugs out. Yeah, there are tons of ideas that come to mind with you. One is, I've already forgotten a couple of them. The 20% figure comes up a lot now. And there's a lot of discussion, but I don't think a lot of good science yet. Let me frame it for the audience, which is that if you look at isolated populations, like the Princess Diamond cruise ship, you only find 20% of the people get sick, right? Now, is that because we change our behavior, or is that because 50% of us or so may have some pre-existing cellular immunity, meaning T-cell immunity, to, if you listen to our Tuesday stream this week, we did a deep dive, began a deep dive that I'm going to get deeper on in terms of the technology around testing for this. But the T-cell memory of having had previous coronaviruses in the form of colds. Which do you think it is, or is it both?
Well, the Diamond Princess is a great example. That is such a perfect little microcosm, because here's a cruise ship that's an isolated, captive audience. It was parked, as you'll recall, off the coast of Florida for some weeks. They let a ton of people off, but there was somewhere in the range of 250 people between passengers and crew who stayed on the ship. Of that 250, only 50% ever tested positive. But more importantly, of the 50%, Drew, who tested positive, only 20%, not even 19% of them showed any symptoms at all.
Right.
No one became significantly ill.
Now, is that, do you think that is just a feature of the virus, or is that because we all have some pre-existing immunity against coronaviruses, or we just don't know?
I think it's probably a little bit of both.
Yeah.
What we know is that it's simply, in the vast majority of people, is not a particularly virulent, significant virus. Most people, somewhere around 80, I've quoted 80 to 85% from the very beginning, have few, if any, symptoms at all. Now, that could be because it's just not that virulent a virus. It could be because those people have underlying partial immunity because of exposure to previous coronaviruses.
Right.
You have to recall, 25% of all common colds are actually coronaviruses. So there's some cross reactivity. It could be because people do have T-cell immunity that's very robust, particularly children. We know that up until the age of about 16 or 17, T-cells are very, very active. So they wipe out the virus before it even takes hold. So I think it's probably multifactorial. But the point remains that in a captive audience of people, where, if anything, and people are locked, think about if you've ever been on a cruise ship, your average stateroom is what, about 12 by 12, maybe,
Yeah, right.
10 by
Maybe.
10.
No
Okay?
ventilation.
Maybe, yeah.
No ventilation, and they
Unless you
were
have a
locked in there.
balcony.
So you're in there with your spouse. In many of these cases, one individual had tested positive, and the spouse, who is locked in the same 100 square foot space with that person for weeks, never became positive. So it's simply, although I've said, this virus is very real. I'm not saying it's a hoax. I'm not saying it doesn't exist. I'm not a conspiracy theorist. But the virulence of it, how lethal it is and how contagious it is, has been wildly, in my estimation, overplayed. And you can see that by something like the Diamond cruise.
Yeah, even the term hoax, I'm beginning to realize people don't know what we're talking about when we say hoax. I mean, in a weird way, the virus, of course, not a hoax. I mean, that would be a bizarre position to take. But it's not bizarre to say the press is trying to hoax us. Look at this headline from today. I'm trying to share with everybody.
Don't forget about the Jerichos.
Oh, I've got it written down here. Believe me, they're very much part of the story here. Here, this is from Market Watch, which is supposed to be an objective organization. Here's their headline: Coronavirus update. U.S. cases rise towards 7 million after jumping by more than 45,000 in a single day. And I looked at that and went, jumping by 45,000? You mean 45,000 above the 38,000 that we're averaging? No, jumping to 45,000 3 days ago, and then back to 37,000, which is our daily average. What the fuck? Excuse me, am I going to get? Are we going to get?
No, it's okay.
But it was like,
Right.
I read this.
I'll
and
call YouTube.
Like, you have got to be kidding me. You've got to be kidding me. The length. And then earlier in the week, they were using the acronym or the phrase very apocalyptic. It's going to be a very apocalyptic. And if these aren't hoaxes, I don't know what is. You know what I mean? I mean,
yes.
I don't. It's not the virus, not a hoax. The porn around panic, the panic porn, is the press trying to hoax you to buy their goods or click on their stuff. No, am I wrong?
No, you're spot on. And it's the fear merchants are out there and have been from the beginning. And that's the part that I take offense to. So go back for a second to Florida and Governor DeSantis. What you're going to hear is all of a sudden you're going to hear, oh, there's a huge uptick in cases. See, we knew it was going to go badly in Florida because Governor DeSantis made this decision. We are locked into this case-demic. It's not a pandemic anymore. It doesn't even meet the guidelines to be a pandemic by the CDC's own definition. We're stuck in a case-demic, and we are paying attention still to absolutely irrelevant numbers, Drew, because reporting the number of positive cases, as we just said from that cruise line, it's insignificant, it's irrelevant, because if people are cases but have no symptoms, if they're not sick, what the heck do we care? In fact, if anything, they're likely to develop immunity and develop, or at least partial immunity, if they ever see that or a similar virus in the future. So I think that people tacitly are hoping, I think there are a bunch of people who are hoping that Florida bombs and that there's this huge uptick in hospitalizations or deaths or it becomes Armageddon. I don't think it will. What you will see is an increase in cases. And unless that translates into the important numbers, meaning number of hospitalizations, number of ICU admissions, and number of deaths, then I don't care how many cases they end up with in Florida.
Right. It's interesting when you look at some of the data that's out there where you see nationally a marked increase in cases, a bump in hospitalization, but at the same hospitalization rate where we had far lower cases. So we're clearly not. Now, there's going to be, it translates somewhat, right? There's about a 2-week lag, and there's going to be some people get sick. I mean, it just is.
Well, Florida has a high percentage, high population of elderly people. So they probably across the country have, one of the older age, populations. And so you have more people in the high risk categories. All that said, I still believe that Governor DeSantis is making the absolute right decision because, again, the mandate of public health is always to look at the impact, the ramifications of any particular mitigation scheme on the entire population, not just one or two individuals. And so you've got to look at the downstream economic, psychological, social impact of the continued lockdown. And I think Governor DeSantis finally said, we've had enough. This isn't sustainable. It's not fair to the 90% of the population that isn't at risk. And so we're going back to business.
Susan, people are going nuts over my microphone volume. They're just hammering me.
What's the matter?
It's low, 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 low. They can't hear me.
What?
Yep. That's what they keep saying.
Like, what?
So let's go. I've got a bunch of stuff. Let me go dial back to what Susan brought up, the Derricos, which is a TV show we are obsessed with.
Maybe hers is just higher, so everybody has to. Let me turn hers down.
Okay.
I need to turn mine down?
No.
It's at our end.
Okay.
It's a show. It's a couple that have had
doubling down with the Derricos.
They've had 5 sets of multiples or something. They have
that are all natural.
14 kids. 14
Apparently.
kids. And COVID entered the household during the lockdown. And here's the data. All 4 adults. There's a grandmother who got quite sick, made it through fine. A 50-year-old, essentially, father got quite sick, made it through fine. A mom who's about 40 and very thin, and a friend who seemed like he's about the same age, also a fit guy. The 2 of them, all 4 adults tested positive. 2 adults had 0 symptoms.
And all the kids tested positive.
Kids tested positive. 5 had fevers one night, and that was it.
And then the baby that was at risk because of many medical problems.
She had a ventricular septal defect, and she got sick.
Out of it.
She got sick and also made it through.
But the kids were like bouncing around the house like nothing was wrong.
So it's another case study, much like the Diamond Princess cruise, right?
Exactly. And so the numbers, regardless of where you look, fall out pretty much the same way all the time, that about 80% of people who get it have few, if any, symptoms at all. People tell you, I had the sniffles, or I had a fever for a day. I felt lousy. I've actually talked to a couple of people who said they were, quote, sick for a couple days. didn't go to the doctor, weren't sick enough, for example, to feel that they needed to go to the doctor. But 80% of people really come through this thing with nothing at all. Then there's about 10% who actually get sick, meaning they felt lousy for a week, had a fever, might have gone to see their doctor. And then 10% who actually are more, end up maybe going to the ER, spending a night in the hospital, those sorts of things, or God forbid, getting sicker. But the reaction to this, Rue, simply can't be justified in terms of the impact on the entire population. We're not just talking about things, by the way, let's be clear. It's not just that somebody's having, an inconvenience. Oh, it's inconvenient that I had to do X, Y, or Z. We're talking about devastating people's livelihoods.
Yes.
We're talking about people are losing their entire their businesses.
I didn't think our government had, except in settings of war or national security, I guess, had the ability to determine how we move about and our ability to conduct business. I didn't know they had that power. Do they?
Well, think about it. They're mandating across the country that people wear masks, something that in the best case scenario is questionable, that it has, any efficacy whatsoever. So they're mandating that you do something useless, but prohibiting you from taking a drug that is useful, that has think about that.
Yeah.
Once they can do that, and then now we're tasing people at high school football games for not wearing a mask. I don't know if you saw that little bit of footage.
What?
Terrifying. A woman was tased at her child's, I think it was a junior high school football game, sitting in the bleachers because she wasn't wearing a mask and she refused to put a mask on. I mean, the footage is unbelievable. You really need to see the video. People are being arrested for singing, gospel hymns in the parking lot because singing has been outlawed because somebody determined that that's an easy way to spread COVID. I mean, we're seeing things happen in this country, and this is not hyperbole. Yeah, you can find the actual video footage of this stuff. People are being arrested for going to church. It's happening all over. California has been really ground zero for that, shutting down churches and arresting pastors for allowing people to go to church in person. It really it defies logic. It certainly defies the science. And I do think that people will start to push back and question the constitutionality of some of these requirements, as time goes by.
Rain is saying that she actually had a waiver because of asthma, and they tased her anyway. She had a medical waiver.
Oh, the woman at that football, yeah, it was it was horrifying. I really felt like I was watching something out of some communist regime. It was bizarre.
But it is.
Hey, yeah. Susan, you may want to take your phone and go out and see what's going on with my mic. Lots of complaints, and just see what it sounds like to people. Just saying,
because people said it was fine. I'll test it here.
Okay. Because I know on my end in my headset sounds very weird.
Sound good to me.
Okay, good.
Thank you.
So let's see. I'm looking at some of the questions we have here.
Yesterday, maybe because of her.
Something we should talk about, Drew, is this because I've gotten a lot of questions about this issue about whether the flu shot increases your risk of getting COVID.
What's up with that?
Well, there's been a tremendous amount of misinformation about it, and part of it is because people, and shouldn't be expected to, all of a sudden, one of the beauties of the COVID pandemic is that everybody is now an armchair scientist.
Oh my God, that's actually one of the things I want to talk to you about. It's just so disturbing that
I get corrected on a daily basis by Facebook people or people whose moniker says they're a IT guru with 9 years in advertising, but they want to school me about virology. Truly. I am not a virologist, but like you, I certainly understand virology and immunology. And part of the problem with this recent report that came out saying that you had an increased risk of getting COVID if you'd gotten the influenza vaccine is because, number one, people don't understand the difference, or they are conflating correlation and causation.
All over the place.
That's the big problem. So the study that came out was somewhat deceptive. It was a Department of Defense study from 2017 and 18, where they looked specifically they were trying to look at this concept of viral interference, virus interference, which is loosely the idea that if you've been exposed to one virus, it can change your susceptibility to other viruses that may be similar in appearance or completely different, but that exposure to one thing can change how you react or how susceptible you are to another virus. So they were looking to see if getting the influenza vaccine increased your risks or changed your risks or susceptibility of getting other viruses. And they looked at some coronaviruses. The coronaviruses they looked at, by the way, were those that caused the common cold.
Right.
The results of the study is that truly there wasn't a significant impact. There was some increase in people getting other viruses. But if you look at, for example, who, as a physician, we recommend that everybody gets a flu vaccine because that's a smart thing to do. But who are the people you really hammer on, that you really push on? Who are
the
the
elderly and the pre-existing conditions.
Exactly.
Mm-hmm.
So the people who are more likely to get flu shots, if you look at all comers to get flu shots, it tends to be highly overrepresented in those elderly age categories, people with underlying conditions versus healthy 20, 30, and 40-year-olds. So,
and you have people are asking about your training. Tell them again your training so they understand what your public health background is.
I'm a residency trained trauma and emergency physician, which I did for years. Then I went on to get additional training as a mass casualty specialist and in public health.
Right.
So I practice, and I still practice, but I don't have a hospital-based trauma practice anymore, which I did for about 3 decades.
That is a younger folks game. The way I look at it, I feel bad that I'm not doing anymore, but I think that's for a younger man.
Exactly.
So one thing I think that was parsed out in the Florida Roundtable yesterday was the idea that infectious disease is a multifaceted discipline. Did you catch that piece of the study? I thought that was kind of an interesting point, that we should be distinguishing virologists, infectious disease physicians from epidemiologists, from public health officials. These are not all the same thing.
They're not. And as importantly, when it comes to the public health response, and this is where I've weighed in, when it comes to the public health response, epidemiology are only one discipline that should be weighing in. It is pure folly to think that you can come up with a good public health response simply following, for example, some epidemiologic model that's going to predict how many people are going to get a virus. Because as I've said so many times, public health has got to look at the impact on all of these things, which includes financial and spiritual and psychological and social. The impact of kids, Drew, from the school closures.
Oh boy.
Absolutely. I mean, way beyond the academic impact, which, by the way, I just read another study, I think it was out of Tennessee, where they are predicting a 50% fall in reading ability and 65% fall in mathematics.
And where are the progressives on that? Because the ones that are going to fall off out of bed are going to be the people who need it the most, right? The people who are underserved.
Exactly. So, we now know that this whole remote learning is a joke. Many kids don't have access to the sort of technology that they need to do it. They don't have the support because they don't have face-to-face with a teacher. I've had a number of people contact me because they have kids who are special needs kids.
Oh yeah, that's bad. That's rough.
Capable of learning remotely and who are suffering. Kids on the autism spectrum, kids whether it's visual or hearing issues. Lots of kids are really, really falling through the cracks here. And there's going to be hell to pay for decades after this.
Somebody asked me an interesting question yesterday I didn't have an answer to, which is, we've done a lot of focus on vaccine and cytokine storm. How come we're not coming up with good antiviral therapy for the viral active stage of the illness?
Well, it's because, as you know, it's been politically incorrect to say it. I'll say it, but I'm one of the few. I wear Kevlar. Hydroxychloroquine is a great drug. It's been FDA approved for 6.5 decades. Very, very safe drug, super safe.
Hey, not only safe, you're supposed to, if you have a lupus patient, this was in my MKSAP review, If you have a lupus patient who gets pregnant, you're supposed to keep them on in pregnancy. It's so safe.
Correct.
It's so crazy.
This is a drug that's over the counter in almost every country around the globe. It's been on the list of essential medications from the World Health Organization for decades because it's such a critical medication that we know worldwide we can never afford to be low on hydroxychloroquine because it's so useful for the treatment of malaria.
Right.
But a very, very safe drug. They've been talking about remdesivir, which is a new drug to the scene, but why you would choose to do it, remdesivir, to be clear, I have nothing against it, and I have no dog in the fight.
Right.
But you're talking about a drug that's IV, so it has to be given in the hospital. It's $3,000 per patient to treat versus hydroxychloroquine, which is somewhere between $10 and $12, depending how where you shop. 10 and 12 bucks is given in a pill form, 5 days at home, and it's an extraordinarily safe drug. People don't want to talk about that. Convalescent plasma, again, it seems to work, but you're talking about something that's not easy. People need to go in the hospital, give blood. It's an infusion. We don't know exactly how much you need to get because it's different patient to patient. So the problem with the discussion about antivirals, and this is really, begs the broader discussion about censorship and cancel culture and shutting down this kind of dialogue. This is, as you and I have talked about before, the basis of healthcare, the basis of medical practice is to have these discussions with other physicians, to look at the data, to look at the research, to think out of the box.
And to disagree with each other.
And to disagree.
Yeah.
Absolutely.
I mean, you and I kind of disagree on masks, but we'll have that conversation later. But that's good because between the two of us, we'll reach some sort of truth.
Exactly.
Sunny Chopra, you're asking us not to talk about hydroxychloroquine. They have still not done the right science on this. They have not used zinc, which is the active agent, and they've not done it in early disease, in spite of the fact doctors use it hand over fist in early illness. I'm telling you, they're using it like crazy out there. Seen it myself, used it myself.
Right.
And I don't know why they haven't done that study. They've done it in advanced disease where it was never designed to be used and should not be used. They've done it in prophylaxis, again, without zinc, but have not done it in early illness. Why do you think that is? It's crazy.
Well, honestly, I think we know because I know and tons of practicing physicians who are using it. I meet on a weekly basis via video with hundreds of physicians where we all compare stories and look at the data and see what we're seeing. And you are spot on. It needs to be given early in the disease process. But frankly, think about it, Drew. There are very few antiviral or antibiotic medications that I can think of that do their best work when you wait till the person's, sick.
Right.
If you don't treat meningitis, for example, within 45 minutes to an hour, truly of the onset symptoms, your outcomes are devastating. Many diseases are like that. So no antibiotic or antiviral does well once the patient's in the ICU. But again, as you said, the quote studies that have been done too late. Some of them used these tremendous doses of hydroxychloroquine, 3, 4, 5 times what was recommended.
That's no good.
They didn't give it along with zinc, which is, as you said, truly the hydroxychloroquine. Just to be clear to anyone who's listening, hydroxychloroquine is what we call a zinc ionophore. It essentially acts to open the door, if you will, of the cell that allows zinc to come rushing in. And it's the zinc that actually wipes out the virus, renders it incapable of replicating. So it's giving the hydroxychloroquine along with the zinc that's really the magic cocktail.
And I talked to, what's the ophthalmologist name? That was one of the guys that stood in front of the federal buildings, Tadaro?
Oh, Tadaro. Yeah.
Tadaro. And he wrote an article, a very extensive and very well-researched article on all the other antiviral properties in addition to allowing the zinc in. So there's other stuff there in addition. But neither here nor there, everybody. And the people are asking what we thought about the roundtable discussion in Florida. We have addressed it a couple of times. We were very impressed. But let me ask, out of that, Dr. Victory, Michael Levitt, I've heard him. He seems like a very sensible voice in all of this. What do you think of his thoughts? And let's springboard off of that into something he often talks about, which is excess mortality.
Yeah, and I think truly, I think that you are right. Dr. Michael Levitt, I think, is a measured voice. He's sensible. He's really been taken what I consider to be a reasonable approach to this, as I hope I have, saying we need to look at the overall impact of any of these mitigation schemes on the entire population. I think when you look at excess mortality, and I've said this from the beginning, so you can hold me to it. We'll have a powwow here on December 31st. When you look at the total number of deaths in the United States in calendar year 2020, so on New Year's Eve, when we do that, and we look at deaths from all causes, and you compare that to the total number of Americans who die in any other average year, how many Americans die of all things, the number of excess deaths will be nowhere near the 210,000, 220,000, whatever we're talking about that they're attributing to COVID, because so many of those people, Drew, either did not actually die of COVID or would have died this year from something else, because the people who have succumbed to this virus are people who generally have been older or ill with other underlying problems, which is not to say, again, that these deaths are not tragic, that we don't mourn them, that I don't feel horribly for the families. But the total number of deaths at the end of calendar year 2020, what we call excess deaths, that would be attributed to COVID will be, I'm guessing, if I had to put a number on it, I'm guessing somewhere probably in the 40,000 range.
Yeah, that's kind of what I would think I was saying too. But what's interesting about what you were saying about people that would have died of something else anyway, and again, we are not minimizing deaths or tragedy. We're talking as physicians who deal with death and dying on a regular basis, and we're talking about the phenomenon of death and dying, that in nursing homes, the average mortality is somewhere between 6 and 12 months. 6 and 18 months.
Right.
And what's interesting, so most of the people that died of COVID would have died within 18 months of other things. What's interesting to me, if you look, I haven't seen any updated excess death mortality, but here we are. This might give it to me. But if you look at the current excess mortality, we had a spike up in the range you're talking about, and then we've gone down below normal for a few months, which is because you take the people, if it was normally a flat line, you take the people that would have died over here, they're no longer here, they die over here, so the graph goes like that. Kind of interesting, isn't that?
Right, which is why I've said that the curve of a pandemic will always flatten. If you do nothing at all, that's the natural trajectory of a pandemic curve, is that it spikes when the people who are most frail, most vulnerable become ill and die, and then it tails off if you do absolutely nothing, to wit, Sweden, okay? Right. So patting ourselves on the back, the collective pat on the back that we flattened the curve by decimating the economy and destroying the lives of millions of people, it would have flattened anyway. And that's the true tragedy in this, is that it would have flattened anyway. If you look at somebody, take somebody like that many people might know, Herman Cain, the
politician,
CEO of what was Godfather's Pizza, I think it was, who passed away this year, quote unquote, of COVID. I don't know how old Herman was. I think he was probably in his late 60s or early 70s.
I'll look it up for you.
But he died, quote unquote, of COVID. Herman Cain had stage 4 metastatic cancer. He was profoundly ill. I guarantee, having spoken to him, not that long before he died, he was not going to see Christmas this year. It's tragic, but he is listed as a COVID death. Herman Cain would have died this year regardless, and it would have been just as tragic. But there are many, many people who fall into that category.
He had colon cancer, which you do not live more than a few months with stage 4 colon cancer. That's
correct.
Period. End of story. Maybe a year or two, maybe. So it accelerated it a bit, but it's not like life was taken away from someone who was otherwise healthy. It shortened a highly truncated life. A lot of the weirdness on mortality figures, to me, is a function of how messed up our death certificate process is here in our country. Yeah. And I don't know if you, as a ER doc, have to fill out death certificates, but an internist, I have to do it all the time. And we get no training, no direction, no guidelines. And we're doing trial and error all the time with death certificate because you write down what you think the person died of, and they go, sorry, we can't accept that.
Right.
And you
Well,
usually end up with cardiopulmonary arrest. Oh, we'll take that. It's like,
correct.
Of course, everybody dies of cardiopulmonary arrest. Everybody.
Exactly. I filled out many, many, many death certificates over the years. And so just so people understand, you're supposed to list the primary cause of death. So as Dr. Drew just said, everybody ultimately dies of their heart stopping.
Correct.
Okay. Cardiopulmonary arrest.
No, Susan, that's correct. And that's the
100%.
only thing they reliably accept.
So
when you're filling out a death certificate.
If you get shot in the head, ultimately what killed you was your heart. You stopped beating and you stopped breathing, cardiopulmonary arrest. So then you write the second. Why did you have a cardiopulmonary arrest? Well, you had cardiopulmonary arrest because you had end-stage renal failure. Okay, and why did you have end-stage renal failure? So then you put in from uncontrolled diabetes. Okay, and then why did you have?
They won't accept that. They won't. I don't think they'll accept that.
But so they only take what I'm saying is you go back. These are so number one cause, the part that gets credited is cardiopulmonary arrest, and then you put as a result of,
and then it goes, oh my God, everyone's dying of heart disease in this country. Then people report that.
But what happened during this whole COVID thing, Drew, was that where normally the number one, the primary cause of a death, cardiopulmonary arrest, is what would get recorded, even if COVID was number 5 on the list.
Right.
We were encouraged to list the cause of death ultimately as COVID. And Dr. Scott Jensen, who I think you may have talked to in the past, a senator from Minnesota, a practicing physician as well, one of the things that got him into hot water, tragically and ridiculously, is that he questioned the Minnesota State Board of Medicine that sent out guidelines saying, even if COVID is number 4 or 5 or 6 on the cause of death list, you should submit it as a COVID death.
Right.
And he questioned that, rightly so, because he said that's really disingenuous. It's intellectually dishonest at best to call that COVID death, in the same way that calling, Herman Cain's death. I certainly wasn't at the bedside and I wasn't the physician of record, so I don't know how it played out. But many of these people are being written down or were coded as COVID deaths. And I think because there's a significant financial incentive.
Well, and let's be fair. I mean, it became a convention to keep hospitals open during the lockdown. And I get that. And it was a convention we kind of all signed up for. But now when you start to look at the way death certificates are filled out, I was looking at the all-cause mortality stuff. And what you see is this wide range of how doctors are filling out the death certificate. So you'll see some death certificates that are just COVID, nothing else.
Right.
Some that are renal failure, respiratory failure, ARDS, COVID, or some combination, leaving out all the other hypotensive, there's many things we could put in there that are part of COVID and part of cytokine storm, but we weren't instructed, of course, on exactly how much of that stuff to put down.
Exactly. And I mean, truly, the financial incentive to end up with COVID somewhere in there, to get it coded as a COVID death, was huge. Hospitals are getting in the range of $39,000, $40,000 more per patient if it ends up being a COVID death. I think I just read the statistic. The state of Illinois has gotten somewhere in the range of $750 million with a B. Okay, Texas got $600 million. Louisiana, $580 million so when you're seeing those kinds of that chunk of coin, there's unfortunately a perverse incentive for the hospital to put pressure on physicians to code these things and to write the death certificates in a certain way. And it's absolutely hyperinflated, grossly hyperinflated, the actual mortality numbers for COVID.
Right. And it's not fraud. It's a convention that we all agreed to keep hospitals open when they weren't allowed to render any other care except COVID. They would have closed had they not done this. But interesting, Kathy Staley wrote something interesting here. She said, in medical coding, you don't list things that were symptoms of another diagnosis. Comorbidities are not supposed to be primary code. That's in insurance coding. We have a whole other set of criteria on the death certificate, by the way, and no universal convention for that. You agree, Kelly?
Yeah, you hit the nail on the head, Drew, because the issue is when you shut down all, quote, elective surgery, and all of a sudden the orthopedic department is essentially closed. All these departments are closed. They're doing no hip replacements, no hysterectomies, nothing that's not emergent. The hospitals would have closed. So there was huge pressure to do that. It isn't fraud when it's coming to death certificates. Had you been doing that on the insurance side, insurance coding, totally different thing.
Different thing.
Filling out death certificates. And you're right, nobody gets training. I never really thought about it. You learn, this is one of those things you learn on the street when you're handing your first death certificate as a resident. And somebody says, fill this out. And you're saying, well, what's supposed to go on these lines?
Right. And then it comes back to you 9 times out of 10, which this is unacceptable. No explanation for why it's unacceptable or what would be acceptable. And so you're literally, you know what happened, and you're trying to reflect what happened based on a bunch of, to me, the greatest one of all is drug addict deaths, drug addiction deaths. Overdoses go down as natural causes. That's a natural death. That is the convention in the death certificates in this country. So when you hear that a famous person died of natural causes, just think drug overdose.
I didn't even know that.
Oh, yeah.
So that's interesting.
Oh, yeah.
Okay.
Oh,
well,
yeah. It's crazy. It's a mess. It's a mess. And I hope somebody's paying attention to this, because the COVID thing has brought it to light a bit. And really, it's really interesting when you look at all the different causes of death. You'll see things you and I know what we're looking at. We're looking at cytokine storm. We're looking at renal failure, ARDS, respiratory failure, blah, 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 all the stuff from that. And the way doctors then fill it out on a death certificate it's just all over the place.
Exactly.
It's really something.
If I've been fighting cancer for 4 years and somebody writes down that I died of COVID, I'm going to come back and haunt them.
Well, you have to have had COVID. You have to have had COVID, but whether you died of it or not is the question.
If I was going to die of cancer, I want to have she died of cancer.
Yeah, but what if you died 18 months earlier from the COVID than the cancer? You would have died of the cancer for sure, but 18 months earlier.
18 months earlier maybe, but
all right.
If I've been battling,
you see how weird and confused it gets.
I'm laying there and shot.
I get it. I get
it.
it.
COVID and.
What do you think, Dr. Victory, about the Russian vaccine and antiviral treatments that are flying around over there? I don't know what to make of that. Do you?
I personally am very pro-vaccine, so let's start with that. I am a pro-vaccine person. I believe that for those vaccines that have been reasonably well vetted for all the childhood illnesses, for example, so the ones that have good safety profiles and for which there's significant risk if you do not get vaccinated, if you were to get that illness, think, polio, chickenpox, measles, mumps, those sorts of things, meningitis, very important to get those vaccines. I am not a believer, number one, that we have had anywhere near the adequate time to test a COVID vaccine. The only way that you can truly tell if a vaccine is safe is time. It's tincture of time, and there is no replacement for time. You need to give somebody an injection and then watch to see what their immune system does. The immune system, as you know, is very, very tricky. It's very sensitive, and it can have delayed reactions to things weeks, months later. So I don't believe that there's been adequate time to fully vet a COVID-19 vaccine for starters.
Well, certainly not the Russian thing that they rushed out, right? And who knows what that is.
Well, I've said before, the optics even of the name in the United States is, Operation Warp Speed. It's a really bad vaccine program name, if you ask me. I wanted it to be called something like really well thought out, fully vetted and researched project, not Operation Warp Speed. But I just don't think there's been adequate time, let alone to determine safety, let alone to determine if it causes the antibody response that we are hoping. So there's two parts to it. You need to determine, is it safe, meaning there's no untoward impact of it,
right.
But is it effective? Does it actually cause your body to mount the immune response that we're looking for? And then furthermore, how long does that response last? If you tell me that, oh yeah, you developed tremendous antibodies to this vaccine and they're gone in 6 weeks.
Right.
Well, that's not very helpful because no one.
Now, to be fair, they won't let us do that. But the question is, will it last a year?
Who knows?
Yeah.
Exactly. We don't know. And so my issue with it, although I'm pro-vaccine, is I don't believe there's been adequate time to determine, number one, safety, number two, efficacy. And then it's up to the individual to determine whether or not he or she believes that they are at significant risk from getting COVID-19, and that is worth them taking the vaccine to prevent it. I can say for myself, I'm not particularly concerned about COVID-19, so I would be hard pressed of my own volition, at least, to take a vaccine for it.
Right. So again, we're sort of always, you and I, trying to weigh out risk rewards, right? So you're saying, hey, I'm not worried about the disease, so why should I add my risk on the side of the vaccination?
Right.
I'm going to get it pretty quick, I think, the vaccine. When do you think you'd get it?
I think I would get it if I felt that I was in a risk category right now, or if the virus itself was coming back in a form, and we know that all viruses mutate. The good news is that the vast majority of the time, meaning 95+% of the time, as viruses mutate, they become less lethal. They become less deadly, less virulent.
Especially coronaviruses, right?
Exactly. But if, God forbid, there was something about this that all of a sudden it started coming back in a different form or looking different, looking like it was more deadly, had more impact on people without underlying health conditions, for example, then I might be compelled to take it. But I sure as heck would like a little bit more time to go by, meaning, somewhere I'd like to see, a year or so of data of people getting it and knowing that people weren't developing any untoward immune response to it.
Yeah, I understand that position. I do. Decadron, you a fan?
Huge fan.
Yeah, me too.
Decadron is a steroid. It's one of many steroids. When you think, Drew, that really the bad outcomes from COVID-19 are largely related to inflammation.
Mm-hmm.
The cytokine storm, however, all the big fancy words we want to put over it, the bottom line is the common denominator is inflammation.
Mm-hmm.
And it's the inflammation that causes people's lungs to fill up with fluid. It's the inflammatory response and the clotting cascade that causes people to develop blood clots around their body. So it all comes down to, if you had to summarize it in one word, it's inflammation. Steroids are the way to stop inflammation. So Decadron, whether you give it IV, IM, inhaled steroids have been profoundly impactful. There have been some great studies and folks getting great results using inhaled steroids, like through a nebulizer.
Of early in the illness? Where are they using it?
As early as possible, like hydroxychloroquine. The sooner you do it, the better. Anything you can do to stem that inflammatory response. Now, one thing that I have not had time to go back and look at, and you might recall this, early on, like February, March, when we first were, there was some stuff lying around that you should not take ibuprofen.
Right.
That ibuprofen, Motrin, was somehow going to give you a worse outcome from COVID.
Yeah.
Now, I eat Advil like it's candy. So I
made note.
I take 800 milligrams just because, I don't know. So really, I think because I'm relatively active, and so I've always got aches and pains. But when this started becoming there was some news about it, I thought, well, I haven't fully been able to research this, but it won't hurt me to not take, Motrin until I figure it out. It's really counterintuitive because Advil, Motrin, is an anti-inflammatory. It's a non-steroidal anti-inflammatory, but it should decrease inflammation. Mm-hmm. So if anything, you would think that something like Advil, ibuprofen, would decrease your risk of a bad outcome, that would stem that, suppress that inflammatory response. So I'm not sure where that hype came from. It was never borne out, and I now am back taking ibuprofen on a daily basis. Yeah. But there was a lot of talk about that in the first weeks.
I remember that.
It doesn't make sense because steroids, Decadron being one, I'm a huge fan, use them early, and people are having great results with it.
People are asking interesting question about hormesis, which is cold showers, and Wim Hof breathing and that kind of stuff. All these things are good. How good, we don't know. Whether it really makes a difference, we don't know. Let's circle back around a couple things. Let's talk about cases versus illnesses. How are we going to start to parse that out? We do 40 passes on our PCR that makes our tests so sensitive. We're picking up just fragments of viruses, not ill people, not infected people even. And there's a lot of virus around, so we're going to pick up a lot of virus. Should we be dialing it down to 25 replications? Should we be specifying whether people have symptoms? How should we work this illness versus case data?
Well, you are exactly right. So that's why we are stuck in this case-demic. And it's really important because people are making public policy and healthcare policy on that basis. If you look just in the state of California, Governor Newsom has set all of his reopening guidelines on the basis of how many new cases. So you're looking at the wrong thing because those cases are meaningless. So if somebody died and made me queen, what Kelly Victory would do is, I would say, number one, you don't test asymptomatic people. We don't do it for any other illness, and we shouldn't be doing it for this because it doesn't mean anything. And there's no reason to believe that people without symptoms are spreading anything. So first of all, I would test people.
On that somewhere, because I've not seen that. I'd love to be armed with data on that.
Yeah, no, there's truly no indication. And even Dr. Fauci, interestingly, Dr. Fauci himself said back in March that although it is theoretical that someone without symptoms could spread this, quote unquote, asymptomatic people have never been vectors for respiratory viruses. And he was right. He was correct. They've now changed their tune. He was absolutely correct. We know that people who are asymptomatic are not likely to spread it. That's why they're asymptomatic, because the virus that they are carrying is either incapable of being replicating or causing significant disease. The point you brought up about the test and the cycles, the 40 cycles, what we're talking about is you stick this swab up somebody's nose, you get a tiny amount of viral RNA on the swab. You have to amplify it 40 times to actually even pick it up and make it register. That viral particle, that doesn't mean that that person has a virus that's even capable of causing disease.
Right.
It might be a tiny fragment
Right.
of COVID-19. It might be dead virus from when they had COVID-19 back in February.
Right.
It might be actually a piece of a different coronavirus that looks a lot like COVID-19. So all of these positive cases are really meaningless unless that person has signs and symptoms of infection, meaning fever, cough, runny nose, chest pain, shortness of breath, those sorts of things. So we've got to stop testing asymptomatic people or change the guidelines, change the test itself so that it is only, that we are sure that it's only picking up meaningful viral particles.
I agree. And then let's talk about masks. So my sort of feeling on mask is no harm, no foul. I don't like the government mandating anything, but if I can do something that might work, it doesn't hurt me, I'll throw a mask on and I'll be diligent about it. Why do you object?
Well, first of all, because I don't think it's no harm, no foul. I think there is potential harm. I think there's potential significant harm on multiple levels. Number one, people were not meant to wear something over their nose and mouth for many, many hours a day. To be very clear, surgeons, physicians wear surgical masks in the hospital for procedures for two reasons. Number one, to keep the surgeon from inadvertently spitting or coughing or sneezing into an open wound, and to keep the surgeon from being splashed or sprayed with bodily fluids, blood, feces, urine, those sorts of things. That's it. There's nothing about trying to stop the exchange of viral particles from one person's lungs to the other. Second of all, they're worn in hospitals that are high oxygen environments in the operating room, and they're largely sterile, meaning there's not dust, pollen, particulate matter flying around that very quickly clog the pores of a surgical mask. You take that surgical mask and you wear it down on Main Street or to the Costco or to the gym where there's all this stuff flying around, you very quickly clog up the mask.
You know what?
So,
it's interesting we're focused on surgical masks. As I think about it, we should be a little more zeroed in because surgical masks also allow things in from the side and things out from the side.
exactly.
Yeah.
That's how you breathe. And that's my point, is that people think surgical mask, you're breathing in it. You're breathing through the sides, up underneath, and like this.
Yeah,
That's where the airflow is going. The mask only prevents me from sneezing into the opened wound of a patient who's on the operating table.
Yeah.
That's it.
Yeah.
So, so I don't think that, but I think the idea is also the very function of your nose and your mouth and your lungs is to obviously bring air in, parse out the oxygen and oxygenate your cells, but furthermore to exhale things that you don't want in your lungs. That's why we cough. That's why we sneeze. That's why it's such a profoundly, it's so hard to stifle a cough or stifle a sneeze, because your body's saying bad thing in here needs to come out. Okay.
Yeah.
If you catch it then in the mask, what happens on the very next inhale?
That
you
comes
suck
back.
it back in. So I don't think it's a zero-sum game from purely a physiologic perspective. Then if you take the psychological perspective, the sociological perspective, I think it is not insignificant. The mask has become a talisman now, Drew.
Yeah.
It isn't actually meaningful. It's simply it's the ring. It's the green, horned defender ring that says, I'm a good person. I care about other people, because it's not actually doing what people think it's doing. I worry about the kids, particularly little kids. I look at these, 2, 3-year-olds at the grocery store, 1-year-olds who are looking around at a sea of people in the grocery store of, faceless people, unable to see facial expressions, unable to see me smiling at them, unable to, it's at that age when kids learn truly how to interpret facial expressions, how to interpret nonverbal cues. And this is not insignificant in my mind at all.
Well, that's very interesting, because I'm a big theorist when it comes to affect regulation and how other minds help us build our regulatory system. And it's through reflected affects on our face, very subtle kinds of changes in the micro musculature of our face, that we learn to understand who we are as it's experienced by another person through all sorts of nonverbal information. That's a really interesting point. One that we will, again, another thing to add to the trajectory, the derailed trajectory of an entire generation here, in addition to the cognitive and the social.
When you combine it, Drew, with our reliance on social media, which has already taken us down, I think, a very bad path in the first place. The idea that people, are these nameless individuals who pop up on your Twitter feed or on your Facebook feed, and it's so easy to make hateful comments or not own things because you don't even put your own name out there. The whole cancel culture, when you add that now to this mask thing, that now you've literally been stripped of your facial expression. I don't know who you are at all.
Yeah.
I think it adds to the overall sort of heightened hostility and really uncivil discourse that we have entered into.
Well, let's get into that a little bit. There's a wholly other topic here, but I thought it'd be interesting if we parse this out a little bit. Somebody said to me, I think social media has a borderline personality disorder. And I thought, well, that's an interesting way of constructing what goes on in social media. But I wrote an article, a book about narcissism in about, was it 2010? And in there, I wanted to write a chapter about pre-revolutionary France, because I couldn't find another period of history where there was so much childhood trauma and so much narcissistic, what we call cluster B disorders. I worked in a psychiatric hospital where I was there in 1983, where we used to see all kinds of different personality diagnoses come in, dependent, OCD, all kinds of stuff. And by 1988, it was all the narcissistic disorders, cluster B. And there's one thing that happens when there's been a lot of childhood trauma is people, as a way of regulating their aggression, gather together and scapegoat. They martyr on their side and they scapegoat on the other side. So they literally have to get blood to scapegoat their aggression so the tribe doesn't tear itself apart, and then they martyr people in their tribe. And boy, we are getting into that big time, aren't we?
Absolutely. We are living now in 100% mob mentality. Either you are on their side or they will absolutely decimate you. Cancel culture is very real. They say either you are part of the mob or you are not part of the mob and you need to be destroyed. And social media has allowed that to happen. People just, it is like piranha. They surround somebody who has a differing idea, and it could be a differing scientific idea. As I said, even my having the audacity to talk about hydroxychloroquine. So I'm not forcing anyone to take hydroxychloroquine. I'm simply saying that I want to prescribe it, and that's between myself and my patient. Why Joy Behar or Anderson Cooper has a right to weigh in on that discussion is beyond.
Literally, on words that they just learned to pronounce, they have a medical opinion on. That's insane. That's insane.
Correct. But so then the mob surround you, and I was looking at what's been happening with some of these vicious mobs pulling people out of cars and beating them senseless. And really, people need to understand that although that is happening physically, that and people find it absolutely appalling that someone would surround a vehicle and rip somebody from the car and beat them senseless in the street. But it's not significantly different from what's happening on social media when you do it through words, when you do it through censorship, when you try to decimate somebody's livelihood or career by posting things about them that are untrue. It's still mob mentality.
Oh yeah, well, it's mob. It's scapegoating, and it's looking for blood.
Absolutely.
Yeah.
Absolutely.
And the other thing, Scott Adams, who's popular on this show too, did a whole thing this morning about, he didn't realize what he was doing, but he did a whole thing on envy. And how envy is that's one of the liabilities of narcissism, which is that envy is different than jealousy. Jealousy is somebody has something I want. It makes me feel bad, but I'm going to work hard, good for them, and I'm going to work hard to get something that they have. Envy is that person has something I want. I'm going to destroy them. Right.
Well, and I'll tell you, social media has made people so much less happy. It's why, I'm not on Facebook. I've never been on it. I call it fake book, but because you're somehow led to believe that everybody, number one, wanted to see what you had for breakfast that everyone was interested in that. And then lots of people give you that affirmation, the positive feedback, because you get lots of hearts or thumbs ups or whatever it is you get. So then that reinforces that people really did want to know what you had for breakfast, and you'll make sure you let them know what you had for lunch. So there's that component of it, but you also are led to believe that everybody has a happy, beautiful life. And so you're left thinking, why am I not doing that? I've worked really hard. Why am I not sitting on a beautiful deck overlooking, the Caribbean islands?
Right.
Why do I not have, this beautiful family? Why do I not have this picture perfect birthday party happening? So you are now living in comparison. You're comparing yourself constantly. Social media is 100% of the time comparing yourself to others, what they have, what they think, what they look like, all of that.
There's a bunch of happiness literature that shows that people have relatively high levels of happiness until they become aware of people that have something more, and the happiness goes down.
No, it's funny. I've spent a lot of time traveling to third world countries, and some of the happiest people I have met have the least amount of stuff. And it's because they don't even know what they're missing. They're perfectly happy living in their very simple environment. And you look at them, and from our perspective say, oh my gosh, they're living in poverty or whatever. But as long as they've got food to eat and family around them, they aren't aware that their home isn't what you and I would consider to be the lap of luxury. And some of the happiest people are those folks. Now, you expose them to Western values, you expose them to what we have over here, you start showing them in comparison what they could have, and very quickly, happiness goes to unhappiness.
Yeah,
by the way, we love our Facebook fans. Don't leave. We love you.
What are they doing? Why? Because
we like Facebook for the reason that our fans are very
I just said I'm not on it. Not that other people shouldn't be. I'm the only person I know who's not on it.
She's being rhetorical.
I do have a pet peeve about friends that put their face on Facebook every day, the same picture over and over and over again. It's like, oh my God, there's her face again. There's her face when she was a child. There's a face from yesterday, eating a pizza. It's like, okay, you're adorable. Okay, we like your face.
See, Susan has envy around faces, evidently, is a thing there.
It's just funny. It's like, oh my God, another face picture today.
You bring something very important there. Was it so long as they have the important relationships and they're healthy, they're happy.
Exactly. And so I think that the where social media could be so useful and where it started. And what I liked about Twitter when I first was doing it was that I actually could get into an relatively academic exchange with people over ideas, people who I otherwise would never have had the opportunity to interface with, people around the globe. I get tweets still, very respectful ones and very thoughtful academic exchanges from people from, out of the country, for example, other physicians who ask me questions, or we swap articles, and it can be very helpful that way.
Sure.
But unfortunately, it's gone down the path like so many other things, like YouTube, and Facebook, Instagram. They all have been, number one, they're being highly censored, which I find not only objectionable, but scary.
Scary, yeah.
People need to understand that what you see on all of these media, what you see is what they, the proverbial they behind the scenes, want you to see.
Mhm.
The wizard behind the curtain decides. So there are people like myself who've been highly censored, people like Dr. Stella Emanuel, James Tadero, many other physicians who have been absolutely taken down. Many of my videos were taken down. Many of my tweets are taken down if you say things that don't fit the prescribed narrative. And I find that very, very scary because, as you and I have discussed in the past, that is absolutely the basis of how we elevate medicine, elevate healthcare, and come to a better understanding of the science.
I'm thinking about Tadaro and Emmanuel. What was the real story with Emmanuel? She seemed so sincere out in front of the federal buildings, and I thought, oh, good, a family practitioner, and she's an African American woman, and she has a strong opinion. I'm anxious to hear what she has to say. And then they just destroyed her.
Yeah.
Tell me what's real there. What happened?
Well, I will tell you what's real is that she is, in fact, an incredibly passionate, dedicated physician. Residency trained, board certified. She happened to have trained in Africa. I think she trained in Ghana. But she happens to be African, so she has a different cultural sort of background. And you'd think that those people who talk about tolerance should be a little bit more tolerant. She practices in an area where she has an almost entirely African American population in the Deep South. She is very, very dedicated to them. She does not, she takes no prisoners. She believed in hydroxychloroquine because she was using it. Her population is almost entirely at risk because she has a population that's largely obese, diabetic, and had other underlying health conditions like heart disease. So she was finding that her folks were getting sick disproportionately, and she was trying to keep them out of the hospital, and she did. Not only did she keep them, people from dying, she kept them from going to the ICU and even being hospitalized because she started using hydroxychloroquine early on, and she found it really, really tragic that it had been politicized. So she went to Washington. I was supposed to be there with them, and it ended up being something that I would never have anticipated. I would never have expected it.
Is she Muslim? Because Ghana is a largely Muslim country, isn't it?
I don't know. I don't know. I don't believe. I think she's Christian.
Okay.
I think she's Christian.
And she had some interesting points of view and thing, but did that affect her ability to practice medicine or her judgment as a physician? No,
it didn't. In fact, I can tell you, I practiced for a long time in South Florida, where I had a huge Haitian population, for example. And I sometimes, in interacting with those patients, you were best to sort of fit into their cultural norms. I've been known to put a root or two on people. to help.
I mean, that's where we're being encouraged. We are encouraged to be culturally conversant and sensitive. Yeah, absolutely.
So I don't make light of it. When I had a huge Haitian population, I adopted and respected their cultural norms. So yes, I would do everything I would do as a Western physician, but I would, we had a lot of rituals that went on where people would come in, they'd bring in their own medicine men, and I allowed that and embraced that, because if that was part of helping that patient get better, it was great. And if that's what they needed, that's great. I spent a lot of time in Brazil working with native shaman. I understand how important those cultural differences are to people, even as you're practicing Western medicine. So in my mind, what Dr. Stella Emanuel was doing was largely embracing cultural norms that she had grown up with, I don't think it impacted at all her ability, or has impacted at all her ability to be a highly qualified Western physician.
A couple things on the chat thread. Hi, Anthony Brown. Welcome. Liv Marr, why are doctors minimizing Rand Paul because he's an ophthalmologist? It's one thing to say he has no training in infectious disease. It's another thing to minimize his opinion. You and I both know, Kelly, when the brightest people in our medical school class, what were the residencies they went for?
Yeah, ophthalmology.
And?
Ophthalmology, probably dermatology.
Dermatology, those are the two, because those are two fields that are interesting and you get a certain kind of lifestyle out of it. And so the brightest people went to those two things.
Right.
And then there's that group that went to cardiovascular surgery and things like that were super, super hardcore. But ophthalmology attracts extremely bright people.
Yes, it does. No, it does. And honestly, in Rand Paul, I think he's articulate. He certainly understands the science. He might not be a virologist, as you said, but he knows the difference, for example, between correlation and causation. He knows the literature around mask wearing. He knows the literature, or lack thereof, around social distancing. He knows that stuff. We've all taken the core courses. So when I make light of somebody, schooling me or pushing back on me who has no background, it's not because I'm not a virologist. I'm not an epidemiologist. I do have a background in public health. But until you and I have both taken immunology, virology, epidemiology, statistics. We've taken all of those courses as part of what we did in our training. And certainly Dr. Paul has done that as well.
Someone says here, my 73-year-old dad recently went to the hospital with panic attack. He watches too much fear porn, and the doctors said they're seeing more of this since the pandemic. Absolutely. Lots of panic attack. Unfortunately, this YouTube user's handle is lick my fart. So I have to call him out. That's his handle. Good for you. But
got a good sense of humor.
But it's an interesting phenomenon that we are certainly seeing, which is lots more mental health issues. Anxiety 4 times last year, panic, depression, all suicide way, 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 way up. The other thing, Kelly, and let me kind of wrap up with this, get your thoughts on it. Here, nationwide, African Americans have been disproportionately hit by COVID and disproportionately sicker because you mentioned the diabetes and heart disease and obesity and that kind of stuff. But here in Los Angeles, they're 9% of the population and only 7% of the COVID cases. They have a higher fatality rate for the ones that do get sick for the reasons we pointed out. But it's interesting to me that they're doing exceptionally well in Los Angeles, and nobody can tell me why. Any ideas?
Well, I don't know for certain. Absolutely, there is some component of it that people tend to stick to their own. We're seeing, for example, Hasidic Jews in New York have done very, very well, and it's largely because they have a rather closed community. They stick to themselves. They don't interface that much with a lot of others. So you may be seeing just some in pockets of areas in LA where people, it's sort of their own little enclave. They aren't interfacing perhaps much with people outside of their community. And they may have essentially developed, if you will, herd immunity within that community. I guarantee, I can't prove it because the study hasn't been done, but I guarantee that that's what's happening in the Hasidic community in New York. They're their own little herd, and they've now gotten to herd immunity. So I wonder sometimes if that's what's going on in the African-American population out there, because you're right, statistically, they are at higher risk because largely of the incidence, number one, of obesity, diabetes, heart disease, but also remember a vitamin D deficiency. Vitamin D deficiency. You know that vitamin D plays a critical role with COVID now, and the African-American, black-skinned people, not just African-American, blacks have a significantly higher risk of vitamin D deficiency.
Right. That's right. And again, back to Susan Pinsky's obsession with
this is my case study
with the Derrico.
They have herd immunity. That family, they all had it.
She is. When we first started watching the show, my wife had severe PTSD just watching the show, and now she has fallen in love with the whole group and can't stop watching it, and watches each show twice now.
But okay, think about it, like the husband is sick, the grandma's sick. She's stuck taking care of 14 kids by
14, who and 5 of
by
whom had
herself for
fevers.
a week and a half.
And one
I
kid in
would've-
the hospital, a VSD patient.
And then she didn't have symptoms, or maybe just feels like shit all the time and didn't realize that she was sick. Because I figure there's that.
Sonny, the issue may be with people of color and vitamin D, the issue of how the vitamin D is converted to the active format when your skin is highly pigmented. So,
Right.
Is that true, Kelly?
Yes, yes, that's exactly true. And so it's also why, for example, we believe that black-skinned people have higher incidence of colon cancer, because colon cancer is very, very highly linked to vitamin D deficiency. So the things go hand in hand.
Interesting.
Dark-skinned people are not able to translate sun and to convert vitamin D into its meaningful form in the body, and therefore have to be repleting it orally, or they are really at high risk for things like colon cancer.
Interesting.
And right now, also of COVID.
I'm going to move towards wrapping things up here, guys. We appreciate you guys being. Oh, it is TLC, by the way. You're asking what channel the Derek was on. It's on TLC, along with everything that's good in reality these days.
I didn't know I was going to like it so much until I saw how we did it. I was just like, wow.
Did you have to watch this with you? I have to see it again.
I watched it twice.
But Dr. Victory, what's coming up for you? Where should we find you?
Well, absolutely on Twitter at Dr. Kelly Victory, and then my YouTube channel, which is Victory Health Inc. There's not a tremendous, I don't post a ton of stuff there, but I certainly will post this video. Will end up making it there.
Right.
Other videos I do with other people, any news segments I do end up there. So my YouTube channel is Victory Health Inc. There are other Victory Healths out there, but Victory Health Inc. And then Twitter, and I try to stay very active on Twitter. So find me there. And if you're interested in swapping articles or discussing things, I'm always open to it. I try to answer as many people's tweet inquiries as possible.
Susan, why are you giggling?
Because I spelled health wrong.
Ah, fantastic. Dr. Victory, thank you as always. I think we did a pretty good survey today, right? We sort of dipped into most controversies that are out there, I'd say. I guess we didn't get into school and that kind of stuff, but that's for another day.
Well, you can get homeschooled by Mrs. Derrico.
Susan can't stop thinking
I
about
can't
this.
believe that she had all those kids naturally and just
14.
I mean, it's crazy. I don't
know what I say about homes. I said the real tragedy is going to be that in 15, 20 years, our country is going to be run by kids who are homeschooled by day drinkers.
But those kids are so well behaved. It's bizarre. And they love each other so much. But then there's something seriously wrong with that, too. I'm not sure.
I'll have to check it out.
Christopher Schock to make a really interesting point here. He says, when you as a physician have Kelly on and it changes your opinion, imagine how the rest of us without medical degrees feel about all the info you're giving us. Meaning that, Kelly, thank you. And you're moving people around, making them think, you're staying away from dogmatism. And we're trying to find our way to the truth. We're trying to keep from the mental health consequences, trying to avoid the panic porn, and we're trying to find our way to the truth. Very simple. Nothing, no ulterior motives here. Do you have any other motivation other than that, Kelly?
Not a bit. I have zero motivation other than to be a voice of reason in a sea of panic.
Right.
If I can be the measured, balanced voice of reason, I consider all sides of it. And I have some experience and some background to bring to it. But it's so far as I can be at least the calming voice of reason during this pandemic, I'm happy to do it.
And our full disclosure, we, Mission for Michael and the Hydrolyte and the addiction recovery place. I'm blanking on the name. Help me. A better look it up.
A better life. Better life recovery and Additics. They're all contributors here, or to me personally, and allow us to keep doing these projects, which we like doing. So, any questions, we're happy to answer them. But it's not, nobody's paying us to do this from the medical world.
I don't know what that means. Oh, I mean from pharma?
Yeah. Pharma is not.
Yeah. Well, but even if, let's say we would tell you if we were, and I would tell you if it affected my motivation or decision making or whatever else we were talking about.
Well, we do want people to get treatment, so we're happy to be sponsored by them.
Oh, we try to be very careful about the people that contribute here. We try to make sure that we're telling you about things that I actually can get behind. And that's an important thing. I mean, I think we have physicians have an obligation, or if we don't get behind it, if we don't know it, don't have any direct evidence, we have to tell you, hey, I've never had any experience with this, but this sounds good to me. Look into it. Dr. Victory, thank you so much.
Dr. Victory doesn't get paid anything.
No, I know. Which is
I don't.
I don't know. I'm thinking about it. Maybe I can.
Susan tried to help her.
I can send you $50. I'll Venmo.
Well, let's do it again soon.
Okay.
Anthony Brown, what are you saying there about Park Bench to Park Avenue? That's his book. Well, I'm a supporter of your stuff, Anthony Brown.
We'll promote
and
plugs.
we'll shamelessly promote you and your book, and Kelly and her Twitter and her YouTube page, because I stand behind everyone that I stand behind. All right, you guys, we will see you. We can do anything over the weekend, Susan?
I don't know, maybe.
That was a sort of a.
I don't know. Are you done with feed? Are you all good to go?
Yep.
Yeah, we're good to go today.
God bless
I'm
you,
going to wrap
Kelly.
up. Kelly and I covered a lot of territory today. I don't feel like we should do more.
She's getting cut out now. Bye.
All right, Kelly. Bye-bye.
Bye-bye.
Dr. Kelly Victory.
Love you.
You guys are all still here on the thread. I still see you. I haven't left yet. Again, as the drunk uncle going towards the door, never quite making it there. I feel like we ought to do something over the weekend,
All right.
if we can, but we'll see.
We'll be around. We'll come in and out. Nothing's planned time-wise yet.
Actually, we're doing that big interview on Sunday, so
Yeah, it won't be Sunday.
yeah, so it might take away from things. So if we don't do it Saturday, we probably won't do it Sunday. And we will see you guys for sure on Monday. Do we have a guest scheduled yet on Monday? Is it Tyrus?
Yes, Monday is Tyrus.
Tyrus comes back on Monday. And Megan Kelly on Wednesday. Do you have a full screen for that yet?
You know what? I don't. I have to look at my email, but there's Tyrus coming in on
Tyrus,
Monday,
great.
and then we also have Megan Kelly on Wednesday. And then also, I haven't put the banner up yet, but everybody go watch this.
The Derricos.
I can't believe they all had COVID-19 and they just
Yeah.
lived through it.
If you want to understand a little insight into what moves Susan Pinsky, watch that show.
You know what? I couldn't watch it for a while because it was just so traumatic. But now I'm just like, oh my God, this woman, she didn't get it.
Well, I'm telling you, if anybody has any contact with them, I would like to interview either the parents or the grandmother.
Hear what happened behind the scenes.
Yeah, because I know how reality's done, and it's not, we're not seeing everything, and they're not having a chance to really speak their mind fully, and I'd love to give them a chance to do that. So if anyone knows anything like that, where should they email, Susan?
Contact at drdrew.com.
Okay, Susan goes through those emails, and she will find it, and I will interview them if I possibly could.
I know.
All right, everybody, thank you so much for being here. We will see you next time. With so much focus on keeping ourselves and our loved ones safe and healthy, it's easy to forget that most of us are going to experience things like allergies, colds, possibly even the flu. So, reminding you, proper hydration is crucial for all of these things. Remember, even slight dehydration can make you feel like you're getting sick, and none of us need that anxiety right now, that's for sure. That's where Hydrolyte comes in. Longtime fans will remember my obsession with Hydrolyte, which is simply the best oral rehydration product I've tried. I'm even more excited to introduce their brand new single-serve powder sticks. Simply pour one powder stick into a glass of water. They recommend 7 ounces. The powder dissolves almost instantly, creating the perfect balance of sodium, glucose, and water. Delivers up to 4 times the electrolytes of your typical sports drink. The other great news about Hydrolyte's new powder sticks, they're 100% all natural. No artificial flavors, colors, or sweeteners. They're available in flavors like orange and lemonade, and they taste great. Hydration is crucial, and Hydrolyte is fastest and easiest way to stay ahead of it. Get your supply of Hydrolyte powder sticks now at hydrolyte.com/DRDREW. Again, that's HYDRALYTE.com/DRDREW, and then use that code DrDrew25 at checkout. According to SAMHSA's National Survey on Drug Use and Health, approximately 20.3 million people above the age 12 suffer from substance use disorder. Incredible. The disease of addiction takes an average of 130 Americans every day. Sadly, the opioid crisis, which many consider the worst pandemic of our time, has been even further perpetuated by the spread of COVID-19. Since the start of the coronavirus outbreak, drug overdoses have increased by 18%. Factors like economic stress and social isolation have led to increased depression and unnecessary deaths. A Better Life Recovery is a premier addiction treatment center in Southern California, offering one of the most highly regarded and comprehensive addiction treatment programs in the United States. Dedicated to helping its clients achieve complete inner and outer transformation, they offer a 45 to 90-day program custom tailored to meet the needs of each individual client. Long-term is the way to go. Many of A Better Life's clients elect to stay up to 9 months to receive additional support. A Better Life Recovery will do whatever it takes for as long as it takes to ensure the success of every client. Are you ready for a better life? Go to abetterliferecovery.com or call 866-581-4401 now.
Real talk.
Headlines have become sickening. They become poisonous.
Dissecting headlines.
Defying state orders. Sheriff Bianco not enforcing what the governor is saying.
Dialed in with decision makers.
Clarify what you actually meant.
Get the answers you need.
At the beginning of this, we were told, don't wear a mask. Is this really helping?
Expect a different kind of newscast. Fox 11 News Special Report. Weeknights at 7.